The truth about mental health misinformation on social media. Attention! The spread of mental health misinformation on social platforms is becoming an alarming issue, and understanding this trend is crucial. Over the past few years, many have felt more at ease sharing their own mental health journeys publicly, a sign that the stigma once attached to these conversations is gradually fading away. For example, if you search for the hashtag mental health on Instagram and TikTok, you'll stumble upon nearly 90 million posts. Terms such as gaslighting, trauma, and toxic relationships are now woven into everyday discussions. But here's where it gets controversial. Not every piece of information circulating online is accurate. In a recent conversation, Stephanie Tsai sat down with licensed psychologist Tasha Caldwell-Harvey, the founder and CEO of the Black Girl Doctor, to delve deeper into this phenomenon. Notice, the transcript in this discussion has been collaboratively produced by both machines and humans and has been lightly edited for clarity. It may contain minor inaccuracies. John Young introduces the discussion by pointing out that many people are now openly discussing their mental health challenges, symbolizing a declining stigma. He notes that with close to 90 million posts under the mental health umbrella on major platforms like Instagram and TikTok, modern discourse now includes mainstream terms such as gaslighting, trauma, and toxic relationships. However, he also warns that not every shared insight is based on verified facts. This gap between personal anecdotes and factual information forms the crux of the discussion. Stephanie Tsai begins by asking Dr. Tasha how social media might be fostering the spread of mental health misinformation. Dr. Tasha explains, with a mix of concern and realism, that the internet's limitless freedom means anyone can share anything. While this openness has its merits, it also means that misleading or inaccurate information can spread like wildfire without any checks on its veracity. She emphasizes that many creators may be presenting their personal experiences as universal truths, which is misleading. The conversation then shifts to a critical exploration of how self-diagnoses and misinterpretations on social platforms might lead individuals to mislabel normal emotional responses, like everyday anxiety or sadness, as specific mental disorders. Dr. Tasha warns that this trend, where typical stress responses are quickly equated to clinical conditions such as an anxiety disorder, depression, neurodivergence, or PTSD, poses significant risks. In her view, such oversimplification can not only undermine those with genuine diagnoses by making them feel invalidated, but it might also erode society's overall capacity to support those who truly need help. When queried about the underlying factors driving these trends, Dr. Tasha offers a nuanced response. She believes that while social media serves as a vital platform for finding community and language to describe one's experiences, a crucial first step for those in distress, it can inadvertently lead to misinterpretations. For many, especially younger generations like Gen Z and younger millennials, these platforms provide a much-needed sense of belonging and can serve as initial steps towards seeking professional help. However, she cautions that this newfound openness sometimes swings too far, with self-diagnoses becoming an identity marker in themselves, particularly in cases involving conditions like ADHD or autism. In her final advice, Dr. Tasha makes a strong case for caution. She urges everyone to resist the temptation of self-diagnosing on platforms like TikTok. She explains that while the cultural shift toward openly discussing mental health is welcome, it has caused a dramatic pendulum swing, a move that now risks confusing personal narratives with clinical diagnoses. Just as one would hesitate to follow unqualified advice about physical health, individuals must apply the same skepticism when it comes to mental health. Personal experiences are valuable, but they should not replace a formal evaluation by a professional. Always remember, if you're considering changes to your mental health care based on online advice, ask yourself if you would trust unlicensed advice for managing a physical illness. What do you think? Have we swung too far in equating personal experience with professional diagnoses, or is this openness fundamentally positive? Share your thoughts and join the conversation in the comments below.